Hello, good evening, everybody, and welcome to our meeting today. It's the Live Grow Conversations March edition, and we are here to have a very wonderful and amazing conversation. Please, if you can hear me, let me know, like send me a wave in the chat or like type something. Let me know that you can hear me and hear me clearly. Okay, and thank you all for joining. I have Nana Yao Ero here. Oh, it's nice to have you. I have Frank Ofe, Perez Jiwanu, Rosina Nyade, that's my open the poet. And then we also have Dr. Stephanie in our midst. We have Zoba as well. And I'm so happy to have you joining or connecting to this meeting. And we hope and pray that at the end of this meeting, we all will have the best of whatever we are coming to do today. So on this note, we are in the Ghana month. So I would want to begin the meeting by saying, God bless our homeland Ghana and make our nation great and strong as much as he makes us great and strong. So we are not going to spend much time talking. I would like to go straight into today's meeting. So the month of March, in the month of March, that's 20th of March, the Federation, is it International Dental Federation, FDI, sets 20th March apart to celebrate the World Oral Hygiene Day. And this day is set apart for creating awareness on our oral health and hygiene. It is in this vein that we put together this webinar to educate and to also create awareness on our oral health. We all probably have met people or experienced some, how should I say it? I think each and every one of us have a mouth, we have teeth, we eat, and then I believe that oral health is important for all of us, and that is why we put this meeting together. I'd like to remind you that this meeting is brought to us by Creative Coaching Ghana, which is a community that explores arts to promote good health and well-being. And Live Good Conversations is one of the programs we hold every month. Last year, we were very active last year, but this year, this is more like our meeting conversation this year. So Live Good Conversations focuses on holding healthy conversations to promote good health, well-being, and individuals. So welcome to today's edition of Live Good Conversations, as we tackle the topic oral health and hygiene. And we want to pay much attention to hygiene, and that's the reason why we have the hashtag. That's no need for bad breath. There's no need for bad breath. Now, the World Oral Health Day, the tagline is "Happy Mouth is a Happy Breath." We have our doctor here, Dr. Stephanie, who is going to help us go through the discussion and then give us all the information. She's going to share her knowledge with us when it comes to oral health and then also habitosis, which is more like the main of this particular. We also have some poets here. I told you earlier that we explore arts to promote health and well-being. So we have some people here who are going to share some poetry with us. Make this all right. Yeah, so we'd like to have Frank. Frank is a poet and a writer, and he's going to share a piece with us. Hi, Frank, please, if you're here, let me see you. Or let us see you.
Hello.
Hi, you're welcome.
Thank you.
Yeah,
Good
so the
evening.
floor is yours.
Okay. So, today's poem it's obvious. The title is obvious. No grief or bad breath. So it goes like this. Charlie, no grief or bad breath. Oh. Now you be the only thing with the cause dismay. When the sun greets you in the morning, but there are battles in your mouth you cannot hide. You could have at least flossed last night, but you just didn't care. You wage a war with plague, with your mouth being the battlefield. It's quite bizarre. It's the food we love to eat, obviously. Spicy kebabs, candies. I can't lie though, they are very sweet, but they leave their mark. Yeah, they do. A reminder to brush, not once, but two. And don't forget the tongue, my friend, the tongue. The red carpet where the bad odors get interviewed. Scrape it clean and you'll be free. So try to make the amends. Okay, so here is the main drill. Floss, brush, and rinse. It's quite easy, just for a fresh breath, and also to keep your teeth neat. For when we speak, sing, laugh, and chat, our breath should be fresh, and that is that. So let's agree to take care of our mouth. I want a healthy smile, and you agree with me. Charlie, no grief for bad breath. Oh. Take care of your oral health. So this is why I end my poem. Pleased to meet you all.
Wow, thank you very much for sharing that awesome piece with us. Do we have Malcolm more here? Malcolm,
Yes,
the poet.
yes, please.
Yeah, it's awesome having you here. So we'd love
Thank
to hear
you.
your piece.
Yeah, I'm also happy to be here today. Yes. Smiling without confidence, covering up in order not to offend anyone around. Yes, I do not want that odor to emanate from me to others. They laugh at me whenever I speak. People cover their nose just to avoid me. No matter where I find myself, I'm unable to even open up and socialize. Why did I have to wait for so long a time? Why did I give the chance for bad breath to take over my life? I had command over it. I thought I could stop it midway. Is it nature that I should bring out bad breath? I have suffered this fate before, and now I know I have to make drastic measures against it. I speak with courage and with confidence that I won't give the chance to bad breath to take over my life. Thank you, and it's nice meeting all of you tonight.
Well, thank you very much. I love your poem. Yes, and thank you for all the poems that you guys have shared. To our audience, however or whatever you feel about the poems they shared, kindly put it in the chat box and then give them their flowers as they deserve. All right, so we go straight into action. Miss, okay, let me say doctor. As I was saying, Miss Doctor, anyway. So Dr. then Stephanie, kindly unmute your mic and do justice to the topic that we have here for us.
Hello, everyone.
Good evening, Doc.
Yes, good evening. Hello,
Hi, I
everyone.
can hear you.
Yes, please. I hope you are doing well.
Yes, by God's grace, I am well.
Okay. Thank you very much for having me. Can you see my screen?
Yes, I can see it clearly.
Okay. And thank you so much to Frank and Malcolm for doing a good job introducing the topic.
You're welcome on their behalf.
Okay, so we'll go ahead and then we start the discussion. We are looking at oral health and hygiene, and as you told us, we are not going to gree for bad breath. Okay, so this is what we are going to look at. We are going to look at the definition of oral health. We'll look at the common dental conditions that we can have, the effects of having bad oral health, and how to maintain a good oral health. We also look at the aids that we can use in maintaining oral hygiene, and then we look at dental visits and what to look out for when you go to the dentist. So our parent organization is the FDI, as you mentioned. Then on the 20th of March, we had the World Oral Health Day celebrations. We had the FDI is the World Dental Federation. We had a lot of things to do. We had screenings, public educations, and I believe that it's in line that we are having this presentation. Okay, so FDI defines what oral health is supposed to be. And it says that it's multifaceted and it includes the ability to speak, smell, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expression with confidence and without pain, discomfort, and the disease of the craniofacial complex. So when we talk about the craniofacial complex, we are looking at the whole head, mostly the face, as in when you look at somebody from the top of the head to the chin. Okay, so those are the places. We want to make sure that nobody has diseases in those areas. Then we are looking at other attributes of oral health. Here, oral health is defined as being a fundamental component of health. Hello?
Hello. Yes, I can hear you.
Okay, so we are talking about oral health being a fundamental component of not just your physical, but also your mental well-being. Okay, so when the poets were giving us some of the introduction, they were teaching us, and they were talking about the fact that it can take over your whole life. It can make you uncomfortable. Okay, so having good oral health is important for having a good mental well-being as well. Okay, and it exists along with a continuum influenced by your values and attitudes, and also not just your values, but also your community, because every community has what they perceive as being attractive. For instance, we look at diastema. Somebody feels that having a diastema is beautiful. Somebody feels like it is not having beautiful. Okay. Okay. So then we are also going to look at the fact that oral health reflects the physiological, social, and psychological attributes that are essential to the quality of life. FDI also says that it is also influenced by the individual's changing experiences, perceptions, and expectations, as well as the ability to adapt to circumstances. So as we are having today's discussion, and then by the time we are done, your perception of your oral health will also not be the same as before we had this discussion. Okay. So we are looking at common dental conditions that we can have in the mouth. We have caries. Okay, caries is caca and is adwar. I believe I mentioned it rightly.
Yes, you did.
Then we have gum. Okay, thank you. We have gum diseases, gingivitis, and periodontitis. We can have fractures of the teeth as well. And then we have halitosis, which is one of the things that we are very much concerned about these days. Then we can have tooth wear and tooth impaction. and oral cancers. Oral cancers are not common, but I put them here because they are rising. And with some lifestyle and changes that are coming up, we are having increases in the numbers. So caries is basically demineralization. So when we say demineralization, we are looking at the tooth as a hard tissue. It's a hard part of the tooth in the body, like the bone, and it's made up of minerals. And when we were in school, we learned about minerals such as calcium being important for having strong teeth. So if you have these minerals rather being taken out of the teeth, then you are going to have a destruction of the tooth substance. And that will lead to a cavity. So we can see here this discoloration. It's not only a discoloration, but then it's a hole in that place. And how do you know that you have a hole? Sometimes it's at the back you can't see, sometimes it's in front you can see. Some of the things that you can see about having a hole in your mouth, which we call caries, is first food packing. So when we talk about food packing, when you eat, the food gets stuck over there, you have to use a toothpick to be able to remove it, or the food gets stuck and you realize that it's giving you bad smells, which we call halitosis. Then we have another symptom, which is sensitivity. With sensitivity, you realize that when you take something hot or cold, then you get a sharp sensation.
Good evening.
Which goes away as soon as
the
water is taken out of your mouth.
Okay.
And another symptom of having a cavity in your mouth is pain. When you cannot chew on that side, your teeth is pain, you cannot sleep in the night, you have to take some painkillers before you can sleep and all that. Okay, the reason why we are going through this is so it does not necessarily mean that once you have these signs, you have caries, but then these are some of the signs that are associated with caries. So when you have them, you have to be you have to take steps towards having them treated. Okay.
Yes.
So we have various factors that affect the development of decay, and that is caries or holes in your mouth. So with this diagram, we are looking at 4 things. We are looking at your diet, the kind of food that we take, the type that you are taking, and the frequency. So if you are taking a lot of sugary food and all that, and you are taking them frequently, then you are having these foods are stimulating to the bacteria that cause the cavities in the mouth. So the caries is also an infectious, it's not a communicable disease, but it's an infectious disease. If it's a bacterial disease, please do we get what we are talking about here?
Yes, please.
Thank you. So we also look at having the bacteria in your mouth. So these are different kinds of bacteria that we can have in your mouth. And it's normal to have bacteria in your mouth. And then as we said, it's the diet that causes them to flourish and destroy the tooth. Then the time, cavities don't develop overnight. Okay, they take a long period to develop. So if they start and you stop them, it will not continue. But if they start and then you continue the kind of habit that you have, then these things will continue and you will continue having these cavities in your mouth. And then again, your behavior as an individual, how you clean your mouth, the kind of things that you do. And also sometimes we can have certain diseases of the tooth in itself that can cause these cavities to quickly develop. They are not very common, but they do occur. And so having all these factors in place can lead to you having a lot of caries in your mouth, having cavities in your mouth. And as we've seen, these are some of the symptoms that you can be having. Another common dental disease that we want to look at is gum disease. And a lot of us have gum disease. one thing about gum disease is that it's very insidious in that you don't feel or you don't see a lot of changes in your mouth. It seldom comes with pain. Unlike the caries or having the cavities in your mouth, it seldom comes with pain. So a lot of us just look at it and allow it to pass. Okay, so first it starts with having plaque. Plaque is food particles with bacteria. As I said, we normally have bacteria in our mouth, but when you provide them with a good environment, they will thrive and they will form the plaque, which is a biofilm over and around the teeth. Okay, and with time, as the plaque builds up, it becomes hard, and that forms the calculus, which is a harder form. These things, yellow, in some people's mouth, they are green, in some people's mouth, they are brown, so many different colors. And I believe that as we are talking now, some of us are looking into our mouths to see, do I have something like this? Do I not? And all that. Okay. And then one of the things that comes with gum disease is the bleeding. When you are bleeding, it's not necessarily you see blood pouring out of your mouth, but mostly when you brush and after that you spit out, you see a streak of blood in your in what you spit out from brushing. And that is one of the signs of what we call gingivitis, which is merely having the inflammation of the gums. And when we leave this to progress for a period, we have what we call periodontitis. So when you look in the mouth, what you see is a tooth, and that is just the top part of the tooth. There is another part of the tooth which is inside, and that is the part that is covered by the gum. Okay, that part that is inside can also get destroyed. The support of the tooth can get destroyed. And that is what we call periodontitis. So you can imagine having a pillar. Before you erect the pillar, you will have your foundation. And the foundation, you dig it in the ground before you erect the pillar. So the foundation is what we call the periodontium around the tooth. Then the gum covers it. So as the bacterial action goes on over the period, you have that destruction of the gum, which is the gingivitis. Then it eventually affects the supporting structure of the tooth, and that will give you periodontitis. So we realize that as we people go older, let me not say most of us in this session have not grown that old, but you realize that our grandparents and all that, they have teeth that are shaky, and then they will tell you that their teeth have fallen out of their mouth. They were just moving in the mouth and then they fell off. These are signs of periodontitis. Okay, and it starts from simply having a gum disease and then it progresses to that. We also have fractured teeth. Fractured teeth as a result of impact.
Dr. Stephanie, please let me come in. Please,
yes, please.
The slides have very sensitive photos coming up. We are sorry we didn't see this from the beginning, but I just wanted to give you heads up that there are more sensitive photos coming up than these. So if it will cause some disturbance to you, please just be aware, okay? Thank you. Doc, please, you can continue.
Thank you very much for giving us the heads up. Yes, we wouldn't spend so much time on the very sensitive photos, but then we just have a small 1 second look at them.
All right, thank you.
Okay, so these are fractured teeth. Fractured teeth are teeth that are broken from impact, and the impact can be from sports, accidents, and from hard foods. Okay, so sports, for instance, we have sports like boxing, football, any sports, running. Sometimes you just fall, and that's an accident, okay? You can break your teeth. And sometimes
I think your network is acting up.
hello.
Hi, welcome back.
Thank
Hello.
you. I'm sorry about the connection. Okay, so as I said, you can have accidents. For instance, when you're sitting in a motor, you can fall down. That's one of the reasons why we encourage wearing of helmets, okay, to protect your head. You can fracture your jaws as well, but inside your mouth, one of the things that you can fracture will be your teeth. Okay. Then hard foods require a lot of pressure to grind them down. And one of the things we try to avoid as much as possible is hard food because it can cause you to break your teeth. I don't know how many of us have tried breaking heavy bones and all that, but these things involve a lot of pressure and then it can destroy your teeth. And using our teeth as bottle openers. Nowadays, there are a lot of plastic bottles, so we don't often use the glass bottles with the metallic bottle covers, but then it's one of the things that have been causing the fractures of the teeth. But then I want to throw a question to us. What are some of the hard foods that we can be chewing that you think can cause fractures of the teeth? Oh, any suggestions from the audience?
Actually, we did
Hard
not
foods.
see the question.
Hello?
Yes, I did not hear your question. Or let me see.
Yes. What are
Please,
some of
did
the
you
hard
overhear the
foods that we can eat that can cause fractures of the teeth?
hard foods?
Yes, I gave an example like bones.
All right, everyone, this is a question to all of us. Let us answer. Nana Yao, I can see you. Please let us know some of the
Some of the what?
hard foods that you can eat that can fracture your teeth.
I was going to say bone, but mostly we use our molars and then the premolars for the bone. But so far, I cannot think of a hard food that can cause fracture of the teeth. What nearly fractured my one of my teeth was I was opening a bottle, okay, and
I guess we
I
all
don't
be
know.
able to take a bottle.
Yeah, and
Okay.
it actually chipped my tooth, and then that was the last time I opened bottle with my teeth. So that's what I can say. But for food, I'm not really sure. For bone, mostly people chew bones with their molars, like the one.
So your molars
Yes.
can also get fractured, and your molars and your
Oh,
premolars
really?
can also get fractured. Yes, this is
Really?
just one picture.
Wow.
I'll show you all the pictures. Yes.
Oh, okay. Okay. Okay.
Cam says ice block. As in
Ice
ice.
block, thank you.
Yes.
That's true.
Yes.
I think I agree with the ice.
Ice block. Okay, what about graphic end times?
Oh, yeah.
What's graphic end times? Bro, didn't cut there.
So much, yes.
Yeah.
Yes, so we don't want to make a habit of eating foods like that. Then crabs. You know,
Okay.
those are
Yes,
hard.
yes. Uncle Two Fingers.
Yes. So
It's
those
true
are
that
some
the
of
two
the things
fingers
that
are
can
very
fracture
hard.
our teeth. Okay. Then polo, you know, polo can be very hard.
Yes.
Is it adule?
Mm-hmm.
Right? Am I
No,
mentioning the name right?
but I know polo.
Yes, okay. So those are all some of the hard foods that can. So when we look at it, not just what you bite, but what you chew as well, they can all fracture your teeth. Okay, then let's come to the almighty halitosis, which is bad breath. Okay, bad breath can be true or it can be false. It can be that you actually have the bad breath, or it can be that you used to have it, but it's gone. But because of people's reactions all the time, you estimate or you overthink their reactions to the extent that you think that you are still having the bad breath. Okay. So this is one of the things that we have to try to differentiate, because a lot of young people don't have bad breath, but out of the fear of bad breath, that's what we call halitophobia. They feel that everybody thinks that they have bad breath, but it may not be so. It's just from your mind processing, maybe because there was a time where you did, but it is resolved. But the most important thing is that you make sure that you don't have it, so that at least you do not have to have that fear in you. Then we look at origins of bad breath, where the smell could be coming from. It could be coming from your mouth, it could be coming from having an ear infection, it could be having something happening in your nose. We have something we call the sinuses. They are virtually empty spaces within the head, and they can be filled with certain fluids that can and have infections, and these can give us bad breath. It could be having or coming from your throat when you have tonsillitis, and from your stomach. Okay, you'll be belching a lot. May have maybe some acids and all that. Sometimes it's from having a liver disease or a kidney disease, or a condition such as diabetes. When it is not controlled, it can give you bad breath. Then certain foods. So one of our poets talked about taking a lot of spicy foods. Okay, spicy foods, especially when you have onions and garlics and all that in your meals, you may temporarily have bad breath. But if you make a habit of it, then you are obviously going to have a lot of bad breath. Then certain drugs, okay, and sometimes your medications for certain things, it may not be bad or pungent, but it may be giving you an unpleasant smell from your mouth, okay? Certain drugs, when you are taking them, most of these drugs are not taken for a long period, so it isn't much to worry about. Sometimes when you're taking off them, it helps. Then alcohol, which we all know, nobody wants to be next to somebody when you have taken a lot of, when the person has taken a lot of alcohol and all that. Apart from the behavioral changes, you also have the bad smell coming from your mouth. Okay, then tobacco from smoking can give you bad breath. Then we are looking at when it's from your mouth. Within your mouth itself can be having cavities. And as I said, you can be having the food packing inside the cavity. And those ones will not be able to clean them well. Then they will rot inside your mouth. So just imagine food that is gone bad when you put it down and you cover the bowl. When you open it, so just imagine having something like that within your mouth. It's quite unpleasant. Okay, that's why you need to get your mouth checked and make sure that you don't have cavities. Then we have gingival pockets. So when we talk about gingival pockets, I'll come back to the gum disease. So please, you can see my pointer, right?
Yes.
So this part is where the gum meets with the tooth, the hard tissue that you can see. So just beneath this area, you can have a pocket from having the periodontal disease. And some of these pockets can hide food. So just imagine that the food, all these white places, let me not say white, yellow, all these places are going all the way down. All these white deposits are coming all the way down. These things can also cause you to have pockets, and these pockets will have food trapping inside them. And when food traps inside them, they can give you bad breath. Then the deposits themselves can give you bad breath. These calculus and that we're talking about, they can give you bad breath. Then the tongue. I believe nowadays a lot of people brush their tongue, but when we were growing up, a lot of people were not brushing their tongue because maybe they feel that when you brush, you retch. We have tongue scrapers and other stuff that you can use, but in this, you have to clean the tongue because the tongue, as you see pink, sometimes you see there are some white layers over them. Okay, it's not supposed to be thick white normally because the tongue sheds layers over the period. But when these layers are being shed and then you have food trapping all over the place, then it packs the food with the layers and it gives you bad breath. That's why you have to clean your tongue. Although you cannot clean every single part of your tongue. The very back of your tongue, I don't have a picture of that. At the getting towards your throat, you may not be able to clean it, but the areas that are sufficient for you to clean should not give you bad breath. So let's do that. Okay, try and brush at times as well. So not cleaning your tongue can give you bad breath. Then we are looking at tooth wear. So tooth wear is when you have frictional forces or chemical dissolution. So this one is attrition. And as we have here, attrition is from contact from the tooth, so the teeth, we have the top teeth and we have the down teeth, the upper and the lower teeth, and they contact each other. So from excessive forces during grinding, okay, you can have attrition, then the teeth will wear out and become shorter than they are supposed to be. And some of these things can give you jaw pain. Okay, so this is one of the things that can cause oral health disease, and that disease we call attrition. And these things are, as I said, very slow. They don't happen just overnight. They take some time to happen. So the contact from the grinding, we talked about hard foods causing fractures, but these hard foods again can cause this attrition that we are talking about. So just imagine this on tip like this. Look at the height. Then imagine somebody who has front teeth and this will be the height. Very short. Okay. And as this happens, it exposes the inner layers of the teeth, and then you can be having the sensitivity and the pain. Then we come to abrasion. Abrasion is similar to abstraction, but here, this one is due to your own brushing technique, okay? A lot of us want to have white teeth. We want to have nice teeth. We want to have fresh breath. There's nothing wrong with that, but it's what you are doing to gain that. When you use the hard brush, so abrasion, as I said from here, from aggressive to brushing, as if you are scrubbing, you can hear the like you are trying to, I don't know. Okay, so these aggressive brushing techniques are really not helpful and they destroy the teeth. So if you can see, this is where the gum line is. And then as you go, you realize that it's going higher and higher. Here too. These are very They are not very serious pictures. They are much more serious pictures than this. But if you see this in your mouth, these are the early stages. For young people, with most of the participants you're having young people like this, these are the kind of things you'll be seeing. But if you continue doing this for a long time till your old age, then it's going to get worse. Okay. Then we have something we call erosion. This is the chemical component. When you have acid from your diet or from your stomach, then it's wears off the teeth. So we talked about the bacteria, their action, then their acids causing the demineralization. So this time it's not the bacteria, but it's from your food or from your stomach. So the foods we have here, we have this example of cola. So there is not just Coke or any cola drink. We are talking about carbonated drinks. And carbonated drinks are very common. We take them a lot, functions, snacks, and all that. Okay. These drinks cause demineralization. We talk about demineralization, removing the components of the tooth from there. And one of the other drinks that we take often nowadays, energy drinks, they also have the components that can erode it. So we all know what erosion is from primary school and PHS and all that. So when you have the water washing away the surface layer of the soil, so the same thing with the tooth. The chemicals wash away the surface layers of the soil. And then we have sheet erosion, then you have gully erosion, so all these things, depending on the severity, will affect the teeth, depending on how much you are consuming them. Then with the acids from the stomach, okay, for women in childbearing ages, we have those who vomit a lot, especially when they are pregnant, they are prone to conditions such as the dental erosion. Then we look at another one, which is malocclusion. Malocclusion means poor occlusion. Occlusion is how your teeth come together, the top teeth and the down teeth, how they meet. Okay, so not having them arranged well is malocclusion. Then if it's unfavorable, the arrangement of your teeth are unfavorable, that is also malocclusion. So if you can see this picture, you can see my cursor, you can see that this person has the teeth together, but the front teeth are closed. The front teeth are jetting out, they are projecting forward, okay? And this one is also rotated. The problem with these that if you don't bite well, it can also cause attrition, depending on how the bite is. There can be excessive forces on the teeth. It can also cause gum disease because the arrangement does not help you to brush very well, and it can also cause the cavities. Okay, so this is just one example of different angles of a patient, of a person with malocclusion. Okay, this is a wrong bite. Then we have tooth impaction. When you have tooth impaction, means the tooth is stuck and it's not able to come out from inside the bone. So the teeth, when they are developing, they are inside bone. So this is the gum covering the tooth. From this picture, you can see the gum here. And the tooth is coming from inside the bone. It's supposed to come straight. This is supposed to be how the arrangement will be, straight up, so that you can use it to chew. Okay, but when the tooth is not able to come out, and this is very common with the wisdom teeth. So it gets stuck and then it causes pain. It can end up destroying the tooth in front. It can give you swellings of your face. Okay. Then we also have oral cancers. Oral cancers are not very common, as I mentioned earlier, but then oral cancers are on the rise, and this is because of, as I said, behavioral changes that we are having. So with the behavioral changes that we have, some of our lifestyle, the tobacco use, we have cigarettes, which are not very common nowadays, but we have shisha, which is quite common nowadays, and shisha contains tobacco. Studies even show that a 1 hour session of shisha is actually more than taking 10 packs of cigarettes. So all these things are dangerous, and they contribute to having oral cancers, and alcohol consumption is associated with having oral cancers and different types of cancers, just like tobacco. Then recently we had the cervical cancer awareness month. And with that, we talked about one of the viruses which is also associated with cervical cancer. And that virus is also associated with oral cancers. It's called the human papilloma virus. And somebody will be asking how. Okay, it's from some of the lifestyle practices that we indulge in. Okay, so we know that with HIV, we have the ABC, abstinence, being careful, being faithful, and all that. So using condoms. The same thing applies to the human papilloma virus. If you want to engage in any form of oral sex, then you have to take precautions. You either abstain, or you be faithful, or you use a condom as well. So that is with the human papilloma virus. Then chronic irritation from the sharp teeth. So let's come back to the tooth wear. Okay. Then when your tooth becomes short like this is not the natural way it's supposed to be. So it becomes very sharp. Look at this picture. You can see sharp margins, then the fracture, sharp margins. So a friend who had a chip on the tooth, for instance, sometimes when you have the chip, you can have the sharp margins. And these margins, when they are always irritating your tongue or your cheeks or all that, they can have they can predispose you to having oral cancers. And the thing about oral cancers, early detection. Early detection means you have to be okay, meaning that you have to be visiting the dentist. Then effects of bad oral health. So we spoke about the effects. Our poets gave us the nice intro again, the pain, the discomfort. Just imagine not being able to sleep in the night because your tooth is paining you, not being able to eat the food that you are comfortable with. Imagine we're having some nice buffet right now and your tooth is paining you, you cannot chew. So it means that you have to, when you see this pass, okay, and the discomfort that is associated with that. And then we have the psychosocial effect. And as our friends said earlier, okay, it can take over your life. It can make you not want to do things that you are supposed to do. Imagine having that crack in front of your teeth and having to do a presentation. You not have the confidence to come out and do that presentation. You have met a girl that you really like, but you know your mouth is not smelling very good, so you cannot talk to her. You are always chatting on phone, but you cannot approach her. All those things are bad. And then we are looking at your work output. So whether you're a worker or you're a student, bad oral health can make you spend a lot of time at the hospital, or it can also make you not, for instance, you're in pain, you cannot work. When you're in pain, you cannot work, okay? And then when you're in pain, you cannot study because you cannot give your attention to what you're doing. Then we have the economic effect on individuals and the society. So you are going to spend money, go to the hospital, and that is the economic effect on you. If you have to work, if you work a kind of job that requires you to be there to make money, you are going to lose out being there. Then on the society, for instance, if you are working for someone, it means that your absence is going to cost the person because the person cannot make as much as he could have made when if you had been there. Then we are looking at this, the effects on the society, like the whole country. For instance, the amount of money we are going to use to import things that are to maintain the health of the individual will also rise. Okay, so these are some of the economic things. They have life-threatening conditions. Okay, so life-threatening conditions, for instance, have this cavity in your mouth. And I said that this is the bone. Okay, so this bone, so this is the gum. So let's imagine this as the gum. Okay, and this tooth has a hole on it. And as I said, there are bacteria. So when you have the bacteria, they enter, they go through the tooth, they give you the pain. Then they spread into the jaw. Then you know where your face is. This is your mouth. This is your mouth, your jaw here. And your neck is very close. So when it gets there, you have swelling, then where you breathe through, your airway becomes choked. You cannot swallow, you cannot breathe well. Your life make your life comfortable. Some of these people some of the people who suffer some of these conditions can actually die. It happens, and sometimes it's very hard to explain to somebody that somebody died because of their tooth. It happens. When you go for the funeral, they won't tell you that because the tooth was failing the person. But these are preventable. Okay. So Fiona gave us the disclaimer. We are going to look at a few pictures. Okay. If you're not comfortable, just go for a second. So this is one of them. Having the gum swelling, the cheek, the facial swelling. Okay, we see these things. This is actually when the place has healed. This is another person. Okay, it was actually worse off than this, and you'll be surprised. And these things are happening. You think that it's only in the villages, but you go to the cities, there are people with all these things. So this person, this time, he cannot open the mouth, he cannot chew or anything like that. So we quickly skip that. And we move on to the next part, which is how to take care of your mouth. Okay, and this is from FDI, and we are learning that having a good oral health is also good for the rest of your body, general health and well-being. How do you take care of your mouth? This is something we all know, but we may not be practicing, or we may not know all the details as much as this. Okay, so you use a fluoride toothpaste, and then you brush twice a day, morning and then evening. Then when you are brushing, you're going to brush all the sides of your teeth. And when you're done, you spit out. Okay, you don't rinse so that the fluoride will work around your teeth. Then you clean in between the teeth. Okay, so we have the teeth. Let me show you the teeth. So this part of the tooth is of one tooth. Then you have another tooth like this. Okay. So you want to clean this space. You don't want to leave it. Then another thing too is to limit your sugar intake, because we've learned today that cavities develop when you give the bacteria the food that makes them happy to flourish, and they'll destroy your teeth. So you avoid sugary snacks, especially in between meals. Try and avoid them. Sugary drinks, and favor water. So favor water, drink a lot of water. Try to hydrate not just your body, but your mouth. Rinse your mouth after meals, okay? Then enjoy a healthy and balanced diet. Then lifestyle changes. Try and avoid tobacco. So we talked about alcohol, okay? Then those with contact sports, we have something called a mouth guard. So you see when boxers are boxing, they have this thing where they put in their mouth. That is a mouth guard. You're supposed to protect it. And then we have regular dental checkups so that you make sure that if you have something it's treated before it becomes bad. So we look at the various things we can use to help with our brushing. So the first thing with keeping our oral hygiene, the first thing is water. So after meals, you have to rinse your mouth and then swallow. You don't have to be spitting all around. Just rinse your mouth and then swallow. So it doesn't matter what you took. Okay, it could have been just something small, maybe a biscuit or a snack. But when you wash your mouth, you are reducing the amount of particles there that the bacteria can transform. And then in between the teeth, the food that gets stuck there. It's also good for aesthetics because you don't want to finish eating and when you smile, everybody can see the remnants of the food that you ate around your teeth. Then brushing. There are different types of brushes. You want to use one that is soft bristled. When we talk about soft bristled, we are talking about this part of the brush, the part that is actually doing the brushing. It should be soft. It should not be hard. When we are talking about a soft brush, you see the labels on the brush. You see hard, soft, medium. Okay, you either go for the soft if you get that or the medium. Hard brushes are not to be used. They seem to be the ones that we like because we feel that they brush well, but as we've learned earlier, they can cause tooth wear. And those things are unpleasant. Okay, so you try and then make sure that you get a soft bristle brush. Check the label on the brush. Then we are talking about the size and taper. So the size, some of us, the brushes that we use, they are very big, so they cannot get into our mouth. If it's a child, get a small brush, okay? And there are kid-friendly brushes around. Then we are talking about the taper as well. We have box brushes, which are like rectangular in shape. And we have some that the tip is a bit oval. Okay. So the most important thing is that no matter the brush you're using, you should be able to get to the very last tooth in your mouth. The box brushes are good. The rectangular shape brushes are good, but if you are using it and then it cannot get to the last tooth in your mouth, then you have to change and get the tipped one, which can get towards the back of your mouth. Okay. Then the brushes, we have manual, which is the regular one we use your own hand to brush, or the electric ones. The electric ones are often recommended for those who don't have the manual dexterity. So maybe an older person will brush, somebody who has had a stroke or something like that. You can get the electric brush. Anyone can use it anyways. Then as we mentioned, the fluoridated toothpaste. The reason why we keep on stressing on fluoridated toothpaste is because the fluoride contains tooth. In other countries, they have fluoride in their water, in their salt, they may have it in their bread, milk, and other things. In Ghana here, we do not have those things in place for us. So the major source of fluoride for us is from the toothpaste, sorry. So there are a lot of people spreading a lot of information that fluoride is not good and all that. Too much of everything is bad. The amount of fluoride placed in a toothpaste is enough to protect you, and it is safe at a safe concentration that you will not get poisoned and will not really result in any other condition. So it's important that you check that the toothpaste has fluoride. And how do you know that the toothpaste has fluoride? Is by checking the label. You see the ingredients on it and just make sure that there's fluoride in the toothpaste. Okay, there are different brushing techniques. I was trying to download a video, but I was unable to look at a picture on how to brush your teeth. So most of us are used to brushing, like the scrubbing, brushing, left, right, left, right, left, right, or top down, top down, top down. Okay, so let's look at this one. The first one is that you place your bristles. So the bristles, as I talked about, the white part that contacts your teeth when you're brushing. You place it along the gum at an angle of 45 degrees. So what I'm going to talk about may look like a lot, but it's not that much. As you start and as you practice, you get used to the whole process of brushing. Okay, when you start, it may take you some time. We said 2 minutes. And when you start, it may take you some time, but you get used to it, you'll be able to do all that within 2 minutes. So at an angle of 45 degrees, you are going to hold the brush along the gum lines. Okay, you are going to take about 2 or 3 teeth at a time, and then you are going to vibrate it in a small, like circular motion and sweep it out. So a bit like this, then out. And you can see that the teeth are not closed. The teeth are not biting. The teeth are open. The mouth is open. So roll and then move it out. Okay. So put it here, roll and move it out. Put it here, roll and move it out. You do that for the upper. You do that for the lower. This is on the outside. You do the same for the inside. Okay. It's not very easy, but then as you start, you get used to it, and then you can be able to do it within 2 minutes. So put it at 45 degrees to the lower teeth on the inside, roll it, then sweep it out, roll it and sweep it out. Same for the inside. Okay, the teeth have 4 surfaces on the side and 1 surface on the top. So you want to make sure that all the surfaces are clean, including the top part. Okay, which most of us are good at brushing, but the top part, the part that you used to chew, you want to make sure that you are brushing that side, and then your tongue as well. Okay, then we have this thing called the floss. This is a thread that we used to go in between the teeth. So as I said, we have 4 surfaces around, then we have 1 surface on top. So the surfaces on the sides, in between the teeth, that's what we're talking about cleaning. This place where the gum flows and forms the V shape. So you want to put the thread around in between. You don't force it. You don't force. If you force it, you are going to hurt yourself. You go inside, go around the first tooth, slide out, go around the second tooth, slide out. Like this. So this is one type of floss, and this is also another type. This one is already attached to a plastic. This one you have to wrap it around your hand. Okay, when you wrap it, to make sure that it's tight, then you go round. Here you start around 1 tooth, then you go around the next tooth. So there are 2 teeth in every space that you enter. 2 teeth. Please let's remember that, so that you don't just go once and come out. Around 1 tooth and around that. Okay. Then we are almost completing. We are looking at dental visit. Dental visit should be every 6 months. Okay. Even if you can't, at least once a year, pass by the dental clinic just for a checkup. We talked about early prevention, but how early on your own you can be brushing and all that. But if there's something happening, we have to also look at early detection, and that is with a professional eye to see it. We have this procedure called scaling and punching. It involves using your brush, the machine, to go around the teeth to the areas that the brush and the floss cannot clean, so that we'll be able to maintain your teeth till you are old. Okay, we don't want you to be losing your teeth very early. Then we have something called prophy. This is prophylaxis in short. Mostly for children, we have different versions of fluoride that we apply around the teeth to keep the teeth strong as they are growing. At that stage, it's really, really effective for them. So it's not just for adults. Okay, children, as soon as the first teeth start coming, we start coming in. Okay. So one thing about dental visit is that there's a cost analysis part of it. A lot of people think that going to the dental clinic is expensive. You are going to have to pay so much and all that. But then if you look at it, dentistry is not expensive, it's a neglect. Because when you come and you have a healthy tooth, the most expensive procedure you are going to have to do, which is just the cleaning, is not as expensive as when you have to be filling or doing extensive procedures. Okay. Then a lot of people are afraid of removing their teeth and all that. The tooth can be removed, but the thing is that if you had come earlier, you wouldn't have needed the removal of the tooth. And once the tooth is removed, at this point, what you are looking at is how to replace it and then give you some comfort with your chewing and your smile and all that. So whilst you are waiting, you're actually piling up your cost. Okay. So we are going to have a video from FDI. Please let me know if you can hear.
Open wide, please.
Please, can you hear?
Yes.
I can hear.
Okay. Thank you.
Yeah.
Open wide, please. Hello, I'm Toothy, and I'm a dentist. Do you know what I see when I look in your mouth? I'll give you a hint. It's not just your teeth. Say, ah. Look at all the things a happy mouth can do. Taking care of your mouth makes you feel good and keeps your body healthy. That's right. A happy mouth really is a whole body experience. It can help protect your heart, your lungs, and your brain, and reduces the risk of unwelcome health conditions like diabetes and some cancers. Say, ah. See, eating a well-balanced diet, low in sugar, avoiding tobacco and alcohol, and brushing twice a day with fluoride toothpaste helps you stay strong. And don't forget, regular checkups with a dentist are important too. Take it from me, Toothy. A happy mouth is a happy body. For more tips to keep you smiling, follow me. And bring your toothbrush.
Okay,
Wow.
so we'll end here. Apekaka to everyone. Thank you for your attention. I'm very happy. I'm glad for this opportunity. And then we'll take the questions. Thank you.
Thank you very much for an awesome presentation. Everybody say ah.
Say
Yeah. All through the presentation, I was just looking at my phone screen and trying to check my teeth.
Mhm.
It's crazy, I know. All right, so we have some questions in the comments. Let's take those ones quickly. Then after that, we'll have a poem from Erica Jim. I'm sure she is here. Now, Nanayao has a question. Yes, I'm just seeing it. So Nanayao, kindly get ready to ask your question. Let me take this one. So Asempa Justice is asking, so let me read out his message. I'm watching your presentation with a friend and he wants to know how he can grow back his receding gum. Dr. Stephanie, is there
Okay.
something?
So first of all, we need to get an assessment. Okay. Most of the issues with receding gums that they are due to the aggressive brushing. And once you are brushing aggressively, the gums are moving away because they are disturbed. So they are trying to move away from the trauma that they are experiencing. We have specialists who are very good at bringing the gums back, but then it's not a very simple procedure. The most important thing is to stop it from continuing. So apart from the aggressive brushing, the gum disease can also cause that. So the most important thing is to stop it. But then there are minor surgeries and minor procedures, let me say it that way, to put the gums back. It is not something that can come all the way.
Hello? Hey. Please, can you hear her or I'm the one who can't hear her?
Yes, I'm done with the first question.
Oh,
Can you hear?
okay, that's awesome. Nanayao, kindly ask your question. Nana Yao, please, if you're here, kindly unmute and ask your question.
Okay, all right. I have several questions though, but I'm
All
going to
right.
ask just two.
Take them one after
Okay.
the other.
Okay, all right. So, I thought halitosis is chronic. Is that not so?
Doc, please, is halitosis chronic?
Nanaya, what do you understand by chronic?
Like it's permanent, cannot be treated.
No. That's why I
So
thought
it's not
about the
permanent.
different places that it can come from. The commonest place is from the mouth, and if it's from the mouth, it's very reversible.
Oh, really? Okay. Okay.
Yes, and if it's from having any other disease or from being on drugs or something, then you see the doctor who manages these conditions, and then they will help you. It's barely something that you can say that the child was born with it, or it's something that is stuck on you. Most often it is treatable.
Okay. Okay. All right. Thank you. I was asking this question on behalf of a friend, and he's not here.
Okay. So your next question, because you said you have several.
I have several, but I don't want to take the time of others. So let
Don't
me
worry,
ask the second one, and then okay. You see, I was told that the teeth can become yellowish as time goes by. Okay, and then someone said that he was going to get it whitened. Okay, and another person was arguing that the more you whiten it, the more they become very loose, and then they will start falling off with time. What's your say about it, Doc?
Okay, thank you very much. I knew this question would come up. So when it comes to teeth colors, they are like skin colors. Okay. And I did a little background check on your group, and then I saw that you are anti-skin bleaching, right? So
Yeah.
Anti-skin
one of the
bleaching.
things about these colors is that they are like skin colors, and we have different types. The same way, if you expose your skin to certain things, the skin colors change. The same way when you expose your teeth to certain things, the teeth colors change. Okay. But the thing about the color of the teeth yellowing over the years is that as you grow older, the inner layer of the tooth thickens. Um, it becomes more than when you were younger. And as that is happening, the inner layer is not as white as the outer layer. The outer layer is the enamel, and the inner layer is the dentine. And that yellowing is from the thickening. And as it thickens, it's the color passes through the outer layer, which is the enamel, and the whole tooth looks yellower. Again, as you are aging, your teeth are also picking up stain. Okay. And the extra stain is also discolor the teeth. So if you bleach your teeth, you'll be taking out the stains, but then the bleaching also takes out some of the enamel from the teeth. And as you expose the enamel, it means that the underlying layer, which is the dentine, will be exposed. And that is when you have the sensitivity of the teeth. So we don't recommend teeth whitening. But then if you want it, you can see a dentist who will go through with you and see whether you actually need it, and will help you decide whether to go for it or not.
Okay. Thank you very much.
Nana Yao, are you done?
Can I add one? Just one. I won't ask again.
Yes, you can.
Oh, feel free.
Okay. So what's your recommendation for dental checkup? Like, let's say maybe should we check with a dentist every month or every quarter or every year? Or what's your recommendation?
Okay. So for everyone, we say that at least every 6 months. Okay. But we are in Ghana here. If you can't come at all, at least once a year, there are people who plan it around their birthdays. So you know that maybe the week of my birthday, I always have to go for a checkup. Then you do that. Okay. Depending on the conditions that you're having, you may be asked to come more frequently, like every 3 months. But every 6 months, you should try and come with have your cleaning to prevent you from having the gingivitis and then the gum diseases, all those things that cause you to lose your teeth. Okay. And if there's something happening, we see it early, we treat it early. And as I said, earlier treatments are cheaper than later treatment.
Okay, how cheap is it? A range.
The
A
thing
range.
I
It
want
depends on where you are and where you want to go to.
Okay, let's say maybe
Yes.
you. Maybe your hospital.
I work at Trafalgar. Over here, if you have national health insurance, consultation is covered and cleaning is subsidized by health.
Okay, please
by
can you
national health insurance.
can you give us a range?
So cleaning starts from 100 cedis to 200 cedis, depending on the amount of
Hallelujah.
deposits around
Okay.
your teeth.
wow, that's
And amount of
affordable
work you need to do.
That's
And
affordable,
that is
yes.
very affordable. It's because
because
it's
if you
Okay.
simple
need to do
here and
still
because
for
it's
one.
also a government facility. Okay, these are
Okay.
subsidized so that everybody can have access, but it also depends on you. Because of that, the demand for the service is also high, which means that we are not able to provide at the speed which we would want to. But with time, we'll be able to catch up.
Okay.
After the cleaning, what else? It seems maybe I think you were trying to describe it in
We
stages.
talk about
So
consultation. So during consultation, when you come, you let us know what is your problem. Then we also examine your mouth and check if there is anything that needs to be addressed. So there are so many dental treatments. As you come, you will get to know. Let's not jump the gun.
okay, I understand. So, okay, then I get it. I get it now. During your presentation, I've forgotten the name. You see that yellowish that thing that hardens under the teeth.
Calculus.
Excuse me.
Calculus.
Calculus. That thing. Can they be removed?
That's why we do the scaling and polishing, which is cleaning. Scaling and polishing, as I said, is we use a machine that vibrates the brushes to the areas where your brush and the floss cannot get to.
Okay. Thank you very much, Fiona. Thank you.
Welcome.
You're welcome. And you even helped me ask some of my questions about the affordability and then also about the tooth getting yellow over time. So I think it's cool. I have this question. You mentioned that when we're talking about halitosis, you mentioned some of the causes being when someone has a liver disease. So I want to know if someone has hepatitis, all right, and let's say a chronic hepatitis or whatever, is that a reason or can the person have halitosis due to that?
If the hepatitis is not being managed, the person may have signs and symptoms that will show that the liver is being damaged, and that can be from the bad mouth odor. But merely having hepatitis is not going to give you bad mouth odor.
Oh, okay. All right. And is it can it be hereditary? Halitosis, can it be hereditary?
Halitosis is not hereditary, but if you have malocclusion, which is the wrong bite, not having your teeth arranged well, that one can be hereditary. Okay,
Mm.
there are certain issues that are hereditary, but they are not that common. So if you have those things, they make you have a lot of deposits around your teeth, and then it can be said that it's hereditary, but it's not the halitosis that's hereditary, it's the cause that is being hereditary. But most often than not, halitosis is not hereditary.
Okay. All right, so can it be transferred? Say you have a partner who has halitosis and then you guys kiss often. Is it possible?
No. From kissing, no.
Okay. I also want to ask this. How much toothpaste, like what quantity should you put on your brush when you're going to when you're going to brush?
Okay, so for children, we say a pea size. So the size of maybe one small granite.
Okay.
I think our granules are becoming bigger over the years, but then it was a small one. That's a pea size. For an adult, anywhere from half of the. You see, the thing is that we have different sizes of the brush. Okay, but normally with the rectangular one, half of it is okay. You can move. You don't necessarily need the full one. You see, the full ones are for the aesthetics of the advert.
And then I want to ask, the quantity you use in the morning, should it be the same you should use when you're brushing before bed?
It doesn't matter if you change it. It doesn't matter if you maintain it, sorry.
Okay. All right. I think I've exhausted. Okay, so Silicam is asking us, is it harmful swallowing your toothpaste over time?
Okay, so for children, it can be harmful. That's why we say you should give them the pea size toothpaste.
Okay.
Or you should get them the children's toothpaste. They often have the size, the amount you should use written on them. You should not be swallowing your toothpaste. You should just be spitting it out. It's not meant for swallowing. So it can be harmful if you do that over a period. Okay. But when you are done, you just spit it out and then you can swallow after.
Okay. Rosina has a question, but let me ask this before about swallowing your toothpaste. I'm hearing people talk about this, that when you brush in the evening, you don't have to rinse your mouth. So you just sleep with like after brushing and you spit out, you don't rinse with your mouth. Do you have something to say about it? Is it helpful?
So when we were looking at the FDI recommendations, we mentioned it after brushing you don't spit, so that the fluoride gets to work around your teeth. And as I mentioned, in Ghana here, we don't have fluoride in any other thing apart from our toothpaste. So we have to take advantage of it.
Please, I didn't get that.
I'm saying that from the recommendations from the FDI, okay, which I projected over here during the presentation, we are not supposed to spit after brushing. We are not supposed to rinse after brushing. Just spit out the paste in your mouth and then you can swallow so that the rest of the fluoride can work instead of washing it out.
Then in that case, you risk swallowing the toothpaste if you're not rinsing.
Not the quantity that can disturb you. So these guidelines are developed from research.
Okay.
So you don't swallow it, you spit it out. But don't rinse your mouth, otherwise the fluoride will go.
Okay. So assuming you've got to eat something and you are brushing together with all those food particles, you just spit and you don't rinse. Like it sounds some way to
You
me.
you can rinse before you start brushing.
Oh, okay. Oh, yeah. All right.
Yes, you
That's
can rinse before you start brushing, actually. And then we've also recommended that after eating every meal, you have to rinse your mouth. Okay. Some people are not comfortable with this. Okay, so there's also something that I recommend. It's not part of their, it's not based on research. If you're not ready to not rinse, then keep the paste as you brushed in your mouth for maybe another 2 minutes. Okay, so that the fluoride will work before you spit out. And that one too, if it's too much in your mouth, you risk swallowing it. So then the choice becomes yours to.
oh, okay. I'm actually thinking that you could also do this, like after when you brush and you spit, you can rinse, then you take a little bit of the toothpaste and like just try to like brush around, and that one day you can just spit and then leave it. I feel that one is okay because you've already brushed out the food particles before.
Okay.
Is that a good advice?
So you are looking at swallowing the fluoride, which you are seeing as not as being harmful. Okay. So if you finish brushing, just keep the paste in your mouth for a few minutes. After the 2 minutes of brushing, and after that you spit it out and you can rinse so that the fluoride gets to work around your teeth for some time.
Oh, okay. All right. Okay, Rosina, let's have your question. Rosina, is she here? Let me check.
Please. Okay, so my question is the fractured teeth. So there's this friend who has a fractured teeth, and he's like he got it from childhood. So I don't know if maybe as children get their teeth maybe through the process of crawling or doing something, they can also fracture their teeth in the process. And is there a way to, I mean, go about it like a cure for it, or maybe they can remove the teeth and a new one will
Okay.
grow?
Okay, thank you, Regina, for your question. So the thing about all the conditions I've spoken about is that something can be done, and often, as I mentioned, the earlier the better. Teeth get fractured all the time. Even in your old age, sometimes maybe you are walking, you do not see something, you trip, you fall. As a child playing, it can fall. Somebody can just be moving something and then it will hit your mouth and then your teeth will fracture. All these things can happen. It can be by accident, it can be through sports and all that. But the most important thing is that you come when you notice that you have any of these things and it can be treated. Removal of the teeth in this current generation is the last option that we resort to. We often would want to preserve the teeth for as long as they can. Even if we have to remove them, there are replacement options available. You can get artificial prostheses, just like people have new legs, you can get new teeth as well.
Okay. Rosina, is that all? Do you have another question?
Yes, please. That's all. And also, please, last one, please. With the teeth, the one that is mostly not arranged well, like, so you see people and then the teeth, like, I don't know how to say it, but some are hanging and some are standing. Is
Mhm.
there a
So that one they
way,
call me.
like,
Are,
of
are you
correcting it?
describing
Like, if the
Ronaldinho?
person grow, maybe.
So as
You
I
said,
said, most of these conditions can be managed. It depends on when you come. Okay, the stage that it has gotten to, what is happening. We have braces. Sometimes the arrangement is actually not good because of gum disease. So it's like having a foundation that is not good, and then the tooth is just moving left and right. Okay, so all these things happen. That's why it's important to visit the dentist every 6 months, have the checkup. Most of us have never been to a dentist before. Just pass by, get your teeth checked, okay, and recommend to your friends, your family, and then get them checked.
Okay, let me ask
Okay,
this
thank you.
question, then we round up. So I've noticed this thing on two people. It's more like one of the tooth, it changes color over time. It's like all the teeth are white, and then there's this particular one that is either yellow or brown. I don't know what it is, like what causes that. Can you please say something about it?
Okay. So discoloration of single teeth are often due to having an impact on the tooth. So sometimes you fall down, the teeth does not break, nothing happens to the tooth, but then it's damaged from within, and over the years it gets darker. So maybe when you saw the person 5 years ago, it was looking yellow. Now it's looking brown. Next time you see it's looking dark brown. So those things can be treated. Very important
Okay.
that you get them checked. It also affects like your confidence as well.
Okay. All right. Someone is asking, please, between a mouthwash and a toothpaste, which is recommended and best to use?
Okay, so I want to ask a question. If you have like a nice bathroom, okay, would you want to like clean the place, or you just want to pour the bleach over the place and go?
Hey, someone I know.
So
Okay.
those are some of the things. Okay, mouthwashes are nice. They're actually very good. They also make you feel good. Okay, but mouthwashes never replace brushing. Some of the mouthwashes contain fluoride, some don't. It doesn't really matter whether it does or not. The thing is that once you are brushing, you can add or subtract the mouthwash, but then it's important that you brush. Nothing takes away that.
Okay. All right. Frank is asking that with all these flavors of toothpaste that we have, which one is the best? And I think with that one, you have said it many times that it should have fluoride. We should use fluoride containing toothpaste, right? Okay. Now this
Well
question:
done. I'm
how
proud
do
of you.
you tell someone who has halitosis, like how do you prompt the person, whether you know they know or not, like it's your first time experiencing it from the person? How do you tell the person, especially if you don't have that vibe, open vibe with the person? How do you notify the person to check his or her oral health if you notice bad breath?
Okay, so this is a very challenging one. It's more of asking me about social interactions, but then it's good. It's good you asked. It's important that when you are talking to somebody about the fact that they have halitosis, you take into consideration the fact that the person is a sensitive issue. It can break the person. So they have to find a very nice way of talking about it. Okay. If the person is your friend, you can say, oh, let's go and visit the dentist together. I want to do cleaning. Wouldn't you want to do some? Okay, you can. Buying a toothpaste for the person is also very it's very dicey, but then it's important that you find a nice way. So it's good to get to know the person. Okay, then with time you recommend to the person some of the things. So let's look at this, let's do that. Okay. And it's important that you don't leave the person alone. You go with the person. Once you go with the person, especially when you have a bond with the person, it helps the person to have a check rather than just telling the person that, oh, I think your mouth is smelling, so we should get that about it. And with time, we'll improve on our social interactions and then be able to address that better.
All right. Okay, so well. Ooh, it's 8:36. I think we will end at 8:30 exactly. So at this point, I guess we all have exhausted our questions, and I want to thank everybody for making it to this conversation. I want to give a special big thank you to Dr. Stephanie for doing justice to this particular topic. And actually, her presentation blew my mind. Like she did very well with tackling every bit that we need to know. So at this point, I'll call Erica Jew if she's here to give us her beautiful performance. Then we can say goodbye to each other. Please, this program was brought to you by Creative Scotty Ghana. And you'll be on Facebook, Instagram, our WhatsApp channel to Creative CPA. That's our social media. So you can reach out to us. If you want to be part of the community, the Live Grow Conversations community as well, you can DM me or you can send me a message on my social media. Okay, I'll leave my number in the comments so that we add you to the group for more updates on our subsequent conversation. Next week, we're looking at good nutrition for healthy life, and it's going to be awesome like this one. So do not miss it. Hello, Erica. If you're ready, would like to hear you.
All right, thank you so much, Miss Fiona. Please, can you hear me?
Yes, we can.
All right, thank you so much for the opportunity to share a short piece. So this evening, the title of my poem is I Am Your Tooth. They say I am their pride. They say I give them confidence. I was told their parents waited for months just for my arrival. They say without me, their smile is incomplete. But why? Why will I improve upon your smile, yet you make carries and plate invade my privacy? Food particles constantly wage war with me. Sweet and touch become my headache, yet you pretend I'm part of your body. Oh, can you let the brush weigh the foamy sword? Maybe twice a day at morn and eve, can it scraps and sweep with minty minds, chasing shadows from the light? Can it, as a silent friend, dislodge the sticky hidden blight and leave the surface fresh and bright? Healthy teeth are more than show. I break down food so your body can grow. I am strong and sound. I let you speak and share a smile, both warm and meek. So raise your brush and raise your flaws. Fight the battle, never a loss. For healthy teeth, I am a lifetime game. Let there be a sparkling smile to ease every pain of life. Thank you.
Wow, thank you so much for this. You wrapped up so beautifully. Okay, so all those involved, Dr. Stephanie works at Trafalgar. And Doug, you mentioned that due to the increasing demand, you're unable to attend to everybody like quickly as you should. So we want a little favor from you so that all those on this call, when we come, when we come to Trafalgar, maybe you would do something for us. So what do you say? Something like help us see the dentist quickly, or how should I even put it? Dr. Stephanie, please.
Okay. So when you come around, we'll attend to you. There's a lovely team over here. We make room for everyone. Okay, so when you come,
Okay.
just let us know you were in this meeting and we'll be glad to serve you. Thank you.
Yeah, so please, the promo, let me behave like a celebrity. So just mention my name, you know. Anyways, okay, thank you, though. Thank you so much. So when you go, mention that you were on the Live Grow Conversations in March. Yes, and you're looking for Dr. Stephanie. Yeah, I think with that, you'll be served very well. And I know that Sulikem Sikao might be the first person to go.
Very much welcome. Thank you.
Please, your working hours, is it from Monday to Friday or you work on weekends as well?
We don't
From
work on
Monday.
weekends. There are some
Okay.
private clinics in town which also work on weekends, but over here we work Mondays to Fridays and we accept new people from morning all the way till 12 in the afternoon.
All right,
Okay.
so 12. All right, so 8 to 12, Monday to Friday. This where you go, Live Grow Conversations, then Dr. Stephanie. That's your promo card for this. Please make sure you go and then check your teeth. It's very important because like we all want to be confident in our dresses. Same way you should be confident when you smile, you should be confident when you talk to people. So it is very necessary. And I'm so grateful that you all time this discussion, Erica Joe. Oh, Mama Makita. Oh, you're welcome. But you're just closing. Nana Yao. Hi, Mama.
Hi. Good to see. This is beautiful. This is very beautiful. Good to see you.
Thank you. Good to see you too.
Yeah.
Yes. All right. Shout out to Mama Kida.
I can't hear you. Are you muted?
Oh, yes. I'm muted. So, okay. You can hear me now, right?
Yes.
So thank you everyone for joining us. Nana Yao Ero.
Okay, so sorry, I want to say thank you to I had some of my family joining. Georgina Yeboah is my mom. Yes. And
Oh.
Zoba joined earlier. That's my flatmate as well. She's a good friend. I want to say thank you to them for joining.
Whoa, that's awesome. Thank you for joining all the family of Dr. Stephanie. We are excited that you joined to support Dr. Stephanie and to also participate in our conversation. We'd like to see more of it. Thank you. So at this point, we have closed and we'll be uploading a recording on our YouTube channel, Creatives Coach Ghana. So if you missed any part of this discussion, you can have access to it. We'll share the link on our Facebook, WhatsApp channel, and then Instagram so that you have access to it. Because this conversation is very important to me, like the skin cancer conversation we had last year, May. So please and please go ahead and watch. Even if you have had a full experience today, please go and share the link to others to have a good experience of this as well. Thank you very much and have an awesome week ahead of you tomorrow. When you wake up, brush your teeth and step into the office confidently with a smile. And remember that a happy teeth, happy mouth is a happy body. Say ah. Say ah as we close. Ah. Yeah, thank you.